we have to treat Bala. When we are treating the Bala, one such novel prescription is Bala, Nagabala. When we are treating the Bala and Bala and Nagabala are coming to the picture. You give the prescription of Bala Arishta. Patients are going to be having the improvement. That is Bala concept is identified. So when the patient is bedridden, when the patient is having the status of the chair bound, prescription of the Bala Arishta is identified, where whole Bala concept related with the Jnanendriya, Karmendriya and Manas are having the problem. I am not going to do any physiology. It is not purpose here. It is not my job also. What is there in that particular Panchavidha Vata, and that Panchavidha Vata, how to correlate with the treatment, that part only I am talking. Remaining thing, it's not of my interest. So Pranava. You are seeing the picture of Jivanti here. There are many prescriptions. Plain Jivanti you may prescribe. Jivantyadi Grata you may consider. You may consider Jivantyadi Kashaya. You may consider ethical preparations like Leptadin, where only one drug is present about Jivanti. Why this Jivanti is required? Prana Divedat Panjatma Vayu Pranotra Murdaga starts Akbata's explanation. Prana Praniti Jivati Aneneti Prana. When the patient is having problems pertaining to functions of the normal Pranavata, this Jivanti may be beneficial. And clinical studies and experiences are suggestive of when the Jivanti in different forms given, it is going to be having the positive effect in the patient. Another prescription is Apana. Apasaranayana aniti jivati anena apana. This is the description of the apana. Adhodeshat nissarati iti apana. I am showing one picture of Masha here. Now you can correlate why Masha is identified, etc., etc. We people are knowing that Masha is the Pratinidhi Dravya for Kapikachu. Right from the Charaka Samhita up to Vagbhata or later Nigantukaras, identified the importance of the Kapikachu as well as Masha in the Vata Vyadhi. Now, how this Apana, etc. present? Adhodeshat nissarati. Quality of Masha, one more quality of Masha is Purisha, Sangrahana and evacuation. Patients who are possessed with the phenomena of the constipatory bowel habits, if they are given with a lot of Masha as a food supplement, which is also having highest amount of dopamine, will be having the control on the dopamine and secretion, as well as Masha is going to throw the things very easily, that is things pertaining to the Purisha, and patient is getting the benefit. That's why attention towards Apanavata and its function, Adhodeshat Nissarati, or in other words to say, Apanavata predominant place, Pradhana Sthana is Pakvashaya, Pakvadhanam Visheshataha, and if we are able to treat the Pakvadhana, Pradhana Desha, remaining things pertaining to Vata, subdoshas of the Vata are going to be controlled. That is the idea behind this slide. Urdvena aniti, jivati anena iti udana. We are having a lot of explanations. Udana. Vak pravritti prayatnorja balavarnas pratikriya. Now identify the functions of the Parkinsonism spectrum, Vak pravritti. in one or other place, it is going to happen. Prayatna, Urja, Bala, Varna, Smriti, Kriya. When we are talking about this one, Vak Pravritti, these are three and remaining things are going to happen. It is there. Hence, we have to treat the Udana. Prayatna is directly proportional to the phenomena of the motor activities. Here he talked about this Varna. This Varna is not related with complexion. In the Vata Vyadhi spectrum, we have to consider Varna as syllables or the Akshara or the letters. Varna means any problem pertaining to Varna in the sense it is the syllables or letters or the Akshara. It is the phenomena pertaining to Udana Vata. We have to treat the Udana Vata. Smriti Kriya. In the phase end or in the terminal phases, patients are having the problem pertaining to the Udana Vata. They may end up this with this Pratikriya. Now, why this particular slide is required for the deliberation? Only one reason. Udanam yojet urdhvam. This is the principle of treatment. When we talk Udanam yojet urdhvam, all the Jatrurdvagata karmas to be considered here. Jatrurdvagata karma in the sense what? Jatrurdvagata karma in the sense Nasya karma. We will come to that particular Nicola concept later on. Nasya karma is one of the principles of treatment. Treatment pertaining to the Shirodhara is related to Udana. Treatment pertaining to the Talapotochil or the Taladharana is also related to Udana. So that is actually identified here. Then comes the matter pertaining to the Vyana. Vyana iti sarva shariram vyapnoti iti Vyana. When the patient is having whole body involvement, specifically whole body involvement in the sense what? Whole body involvement in the sense patient is having stupid fixture. When the patient is having the gait related with the running towards one particular entity, at that juncture we have to consider Vyana. Here, our Pindasvedas, different kinds of the Pindasvedas are going to be beneficial. Sneha Yukta Sveda, we have to employ here. That is the idea behind the Vyana slide. Now, next matter is related with the Samana. Samyak prakarena prenati aneneti samana, that is gacchati. There is a novel shloka in Anyonya Avarana of Charaka Chikitsa, wherein Grahani dosha may be identified in the Vata Vyadhi with Avarana and patient is having the Vata presentation. One small clinical picture I will give you. A patient having the 30 plus years. Patient is having a lot of stress. He is a fleet owner. As he is a fleet owner, he is having a lot of stress pertaining to the business. Ended up with the phenomena of the Grahani Pradosha. And slowly the patient is ended up with the Vata Vyadhi. And this Samprapti should be viewed from the point of Grahani Samprapti. So Vata Gulma Radroga Pliha Shanki Chamanamaha, last line of Vataja Grahani Roga. So Vata Roga, Gulma Roga, Radroga. The same patient in due course of time of 4 to 5 years ended up with myocardial infarction. Means where we have to treat the Grahani Pradosha. If we are able to treat the Grahani Pradosha and Grahani Roga with Pichapasti and allied things, patients are having the benefits. This is one of the uniqueness of the Samana Vata, involvement in Vata Dosha. And such patients are aplenty nowadays, owing to different kinds of stress. Already I mentioned this one. Dharuna Guna when we are talking. Chakrapani commented on this one, and here the Charaka Sutra, 12th chapter, Shushirakarani Sharirana. What are those? Prakopayanti, Vata Prakopanani Kalu, Rukshalabushita Dharuna, Khara Vishada Shushirakarani Sharirana. And I highlighted one Ghana. Vata Shamanani Puna Ghana Karani Sharirana. It is not mere theory. When the patient is having such a type of complications, particularly with the Dharuna Guna, Katina Guna, Sushiratva we may identify in today's perspective related with bone mineral density, etc., vitamin D, etc. Prescription of Shataputi or the Sahasraputi Abraka Bhasma helped in such patients. I want to draw the attention towards the Abraka Bhasma usage. That's why the Ghana. If you are carefully observing the Paryaya Pada, synonyms of the Abraka, one Paryaya is Ghana. Samskarasya Panchada Prokta Ghanasya Parameshwari is specified. Shataputi I have prescribed, showing dramatic result. But rider is in affordable patients only. We are not in a position to prescribe in all Tom, Dick and Harry. Shushira Karani, Randra Karani, Sushira Viparito Ganaha. You see the commentaries. Even such patients are liable for fracture or osteoporotic changes significantly. That's why, from our perspective, we have to consider the prescription pertaining to the calcium. That is Pravala prescription. One example is patient aged like that of 60 plus and having the history of some 15 years of ulcerative colitis, treated successfully and everything is under control. Still, on one day, one meager fall ended up with the phenomenon of the fracture of the radius, Colles fracture. And we have to identify it is the depletion related with the osteoporotic changes, vitamin D and calcium and phosphorus. Prescription should be Pravala Bhasma. After learning the lesson from this patient, problem, Pravala Pishti or Pravala Bhasma was prescribed and it successfully prevented such complications, especially the patients who are having such a problem related with the cramps in the calf muscles reverted completely. This is one example for we people how to put the Rasaushadhas in case of such condition. Then is Vata Kala Akala. I am not going to teach anything like that of the Vata Kala Kali Adhyaya now. What is required for the prescription we will talk. Whole physiology we identified. Vata Kala Akala. Guna and Dosha we are talking. He started with the Tatra Vayu Tantra Yantra Dara. We are not bothered about Tantra, Yantra, etc. Whole body, one unit. Hence, whole body, one unit, we have to treat whole Vata Dosha. In other words to say, we have to treat all the Panchavida Vata specifically, and we have to proceed about the treatment of the akinetic rigid syndromes. Hence, you are seeing Pravartaka Cheshtanam, when the motor activity is also involved in akinetic rigid syndrome, you will see the physiology as having the pathology. Sarvendriyanam Udyojakaha. We consider the same thing in Bala. Here also in Vata Dosha it is present. We have already seen this particular phenomena in case of the Shuddha status of the Vata Dosha. Vayur Ayur Balam Vayu. Pravartako Vachaha. Again, treatment is related with the, not with the kapha dosha, treatment with the vata dosha. The slow, monotonous voice, involvement of the syllables or the akshara, we have to consider this particular faculty is having the problem, that is language faculty. I am using the term language. Why? In neurology, we are talking about three distinct things. One thing is related with the language or the fascias, aphasia, dysphasia, etc. Another one is dysarthria, anarthria, etc. And finally, we are talking about phonation. So patient may be having the aphonia or dysphonia in the final phase. Patient may be having the dysarthria meanwhile in the middle phase. Patient may be possessed with the phenomena of the language disruption in terms of the dysphasia. For such prescriptions, we have to identify pravartako vacha. When we are doing the taladharana with vacha, when we are prescribing the yashtimadu, for medya rasayana, yashtimadu is having the highest thing, or yashtimadu, or selection of any specific gratakalpana, pravartako vacha is going to be having the treatment. A patient in the initial phase may not be having anything related with the involvement of the walk. Then there is no hard and fast rule that we have to prescribe this vacha. We have to prescribe the yashtimadu. We have to prescribe the panchagavya, etc. Not required. Next faculty is palavarna sukhayusham upagatayacham. If the vata is not perfect, Bala, Varna, Sukhayu is going to be the casualties. It is plainly energy quotient. We have to consider the energy quotient. What is this energy quotient? To the given phenomenon, if the person is not able to execute it, take example, ask him to carry 10 kilograms of weight for 500 meters. It is one of the tasks. And that task is not completed. His energy quotient we have to consider. It is less. Bala varna sukhayusham upagata. Since the energy quotient related to the different perceptomotor capabilities are having the compromise. Ayusho anuvritti, prolongation of lifespan. It is the phenomena pertaining to the Vata dosha, prolongation of life. We have observed a lot of things. Patients with the akinetic rigid syndromes compelled to embrace breath within few years, 1 or 2 or 3. Whereas there are many patients who are having the proper bala, going to drag on for many years. I have seen a lady who possessed Parkinsonism for more than a period of 30 years with medication and with lifestyle. She completed her lifespan at the ripened age of 80 plus. Ayusho anuvritti. There only maintenance of the Vata dosha considered. This is the lesson for we people to identify the yapana vastis. Yapana, Ayusho yapanam. That is important. At that juncture, Nuvasana or the Yapana Basti selection is identified on such faculties. Kshepta Bahihi Malana. It is the normal function. Charaka Chikitsa Sthana Udavarta Chikitsa Dhyaya. When Purisha Udavarta is specifically present, different kinds of Vata Vyadhi are going to happen. He specified, Anyecha Bahavaha Rogaha Anilothaha. There are many disorders related with Vata dosha may happen. He is not specific. It is related to any kind of disorder having this. Today, if you are going through the research journals, two things are there. In subsequent slides, I have shown one, cause and effect theory. What is that cause and effect theory? A person with the chronic constipatory bowel habits for a prolonged period of some 5 to 10 years or 2 to 5 years ended up with the phenomena of Parkinson's spectrum or akinetic rigid syndromes. It is the cause ended up with this one. At the same time, patients who are having full-fledged Parkinsonism having one symptom, effect as constipation. In both the situations, ignorance of the previous constipatory bowel habit leading to Vata Prakopa or the surplus Vata which is present in the patient. That's why I have stated in the earlier slides. Kampa Anaha Shakrat Grahan. That Shakrat Graha Vradhavata concentration must be seen here in this situation. Kshepta Bahi Malanam. If the mala is going to be evacuated properly, symptomatic changes going to happen in the patients very quickly. That is, when the patient is having such symptom, if we are able to plan Anuvasana Basti or simple Matra Basti, or even simple Sneha Kalpas, internal Sneha Kalpas, patients are going to be benefited. That's why this slide is put. Harshotsaha Yoga. Maintain the Vata. Things are going to be corrected. In the initial one of the slides, fourth slide, dejected mood is depicted. The patients are the prey for depression owing to their inability. They are requiring help, assistance for each and every specific movements of the body. May be related with it is urination, may be related with something else pertaining to that one, or something like that, taking the medicine, having the robes, disrobing, etc. Everything they want something like that of assistance or help. When that assistance or when that help is having the disarray, they will be having the dejected mood and slowly ended up with the phenomena of depression. And the root cause is not kapha here, because many times it is mistaken. The word Tushni Bhava quoted in Kafaja Unmada is mistaken to this one, and treatment of kapha is actually done. It is not for the kapha, it is the treatment for the Vata dosha. And with this Sneha, you consider Kalyanaka Krata, you consider Mahakalyanaka Krata, such Kratas are going to subjugate the Vata dosha, maintain the Agni, as well as it is going to correct the depressive or dejected mood. That is for the selection of the particular grata or the treatment. Monovyarshayati, same thing. Sarvendriyani upahanti, it is related with the prakopa. Bhaya shoka, moha dainya. These bhaya shoka, moha dainya, etc. are because of the advanced phase of the Parkinson's spectrum. Owing to the disability, this may happen. In the first slide, we have considered one important thing, that is old age person, had tremors only like this one. We have to view this particular phenomena, Jara. Jara is one of the Vyadhi, Swabhavika Vyadhi. We should not ignore that one. Here, while talking about this one in Vimanasthana, Charaka said, Shiryamana Dhatu Guna. Other terms from other samhitas, Brashyamana Dhatu Guna, or terms like the Kriyamana Dhatu Indriya, these are identified. Successive breakdown of quality of tissues. I am using this particular term. Successive breakdown of quality of the tissues. That is Dhatu Guna. Shri Hiriyamana Dhatu Guna, Brashyamana Dhatu Guna, Shiryamana Dhatu Guna, etc., etc. So these are happening in Jara. That's why there is one of the important word quoted in the Arsheya Grantha. Deha and Sharira. Little bit deviation from this one. There are two terms. One is the Sharira, second one is the Deha. What Vedas are telling, Dihi, Deha, up to 40 years of life, we have to call the human body as Deha. After 40 years of life, we have to call the body as Sharira, because Shiryate Anena iti Shariram, Shiryamana, that particular successive breakdown happened. Even Samhitas are also, even Susruta identified Parihani Avastha after 40 years. Today is Yavana, tomorrow is not something like that of the Vradhapya. This middle age is so important. Vradhi, Yavana, Parihani. Parihani Avastha. That successive breakdown happening for years together, and finally at the 70th age, patient may come to the phase of the Chara, the old age. That is considered. And here, when he told Shiryamana Dhatuguna or Prashyamana Dhatuguna, we have to treat with the Rasayana. Purve Vaisi Madhyeva Manushya Rasayanam. When to give the Rasayana? In the early childhood. Madhyeva Manushya Rasayanam, not in the old age. If the patient is 60 or 70 or 80 plus, give Chavanaprasha, Bhargava Prokta Rasayana, patient may not be benefited immensely. Whereas on the contrary, in the Palya or even in the Madhyama Avastha, if it is given, it is helpful for the patient. That's what he is telling in case of Charaka Vimana. Hriyamana Dhatu Indriya Bala Virya Purusha Parakrama Grahana Dharana Smarana Vachana Vijnanam Brashyamana Dhatu Gunam Vayu Dhatu Prayam Kramena Jirna Muchyate Avarsha Shatam. What else is required for the identification of advanced phase of akinetic rigid syndrome? You see, Riyamana, which one? Dhatu, Indriya, Bala, Virya, Paurusha, Parakrama, Grahana, Dharana, Smarana. Higher mental functions, Grahana, Dharana, Smarana. Is not Hastam Grahana. This Grahana is related to the higher mental functions, because already he talked about the Indriya. When Indriya is considered, Pani is there, Grahana is its function. So this Grahana is not Punarukti dosha, it is related with the higher mental function. Smarana, Vachana, Vijnana. Everything is going to be broken down successively. Brashyamana Dhatu Gunam. Surplus of the Vata dosha, indication that treatment should be based on the Vata dosha Chikitsa only. That's why Vayu Dhatu Prayam Kramena. Then he talked about prognosis. With all the said and done, Upapalanartham Mahagadanam Shrunu Somya Raksham. Don't claim that this is going to be cured. It is Upapalanartham. One has to consider the patient having the palana. This term word or the thing, palana, is considered even in case of the marma. Nahi basti samam kinchit marma paripalanam asti. Why? Shiras is considered as one of the important marma by the Charaka. If you are thinking from the point of Shiro marma abhigata, there is a term in that particular shloka, kampa. I am giving a link further. You might have heard about Cassius Clay or Muhammad Ali, one of the greatest boxers, black boxer in US, who was professional as well as amateur boxer. He won Olympic gold also. He won actually professional boxership also. In the later phase of life, he suffered from the Parkinsonism. And for his condition and like condition, physicians nomenclated as punch drunk syndrome. Why punch? Because he suffered lot of things, punches in boxing. Drunk, why? While walking, he is having the gait of that particular drunk. That's why it is punch drunk syndrome. Now you see, marma involvement, when the shirasya vyate, one feature is related with the kampa, that diagnosis is falling under that. You have to prescribe the treatment of the basti. Nahi basti samam kinchit marma paripalanamasti. Treat conditions with basti chikitsa yapana basti and give whatever the possible benefits to the patient. Means tomorrow a boxer comes. I have seen one such boxer, Naresh Kumar. He was at Jamnagar in INS Valsura. Later he was transferred to Indira Point, Karnikobar. He is the national champion of featherweight boxing group, very lenient thing. Nearly 4 to some 8 hours of daily punching is there for the box, and this one, that's punching back. He ended up with the Parkinson's. Young, it is nothing but punch drunk syndrome. We were able to give maximum relief to the patient. I am not using the term cure. We were able to give maximum relief to the patient by Baladi Apanavasti. Now you can understand why this is important. Basti Chikitsa selection, causes nahi basti samam kinchit marma paripalanam. Why basti is identified? Tatra shirasya vihete chikitsa, and this particular picture is completed in the patient. And we should not boast that. Patient will be cured. Why? Very simple. It is Ashtamahagada. Charaka accepted, Vagbhata accepted, Susruta accepted. Out of 8, they are having a unanimous opinion about Vata Vyadhi. Vata Vyadhi is Duschikitsya. Duschikitsya, not Achikitsya. That's why we will treat, we will manage. Okay? And this is another thing, deformity. What Samhitas are saying? After prognosis, deformities, these deformities are going to present in the patient for the rest of his lifetime. The Stamba and Kampa word identified here, Snayu Praktaha. We are having such a type of explanation even in Charaka Samhita, Snayu Gatatva of the Vata dosha. Our line of management should be on those lines. In Snayugatatva of the Vata, Kunchana, that deformity is identified. Stamba Kampa here is specified. And why this is important for the treatment? Just for the sake of, it is not the Upanaha which is going to be given to the particular area where he is having the Kunchana. Deformity is present in the wrist as well as elbow. Deformity is there in the forward bending nature. Give certain thing like the Upanaha? No. Because we have to identify the Upadatutva of the Snayu, and it is Gambhira Dhatutva, and we have to treat the Gambhira Dhatugata Vyadhis on the lines of the Basti. Hence, selection of such thing. When the patient is having the Vinama, forward bending, it is the involvement of the Snayuga Tattva, and we have to treat that Snayuga Tattva, and it is the important thing for the selection of the Basti Chikitsa. Now, involvement of Ojas. Explanation in Charaka Samhita, explanation in Susruta aspect, explanation in Vagbhata's 2 words. We have to take it, sir. In total, these things are suggestive of progressed, deformed, bedridden or chair-bound patients. Gatranam sadanam, stabda guru gatrata, glanihi, maranam iti kshaye. even terminal phase, Marana is also identified. I have seen few patients who are either chair-bound only or bedridden only for the lifetime, ended up with the same phenomena of involvement of ojas. There was little improvement after giving the ojaskara chikitsa. Unfortunately, we were not in a position to correct the total thing pertaining to the ojakshaya, and marana was inevitable. Suppose if anyone asks whether this particular marana is identified, etc., see, there is involvement. When the ojas is involved, marana is predicted. And this prediction of the marana is akin to that of the chair-bound or bedridden status of anything pertaining to the movement disorders. Maybe this one or may not be. Is it only the thing? No. There are many other aspects while treating this one. Few hints I have given already, and specifically in Anyonya Avarana conditions. Sarvendriyanam shunyatvam jnatva sprati balakshayam. This is the phase wherein you are seeing the patient in the bed. Disease progressed over the years, and patient is not responding to any treatment. And at that juncture, Sarvendriyanam shunyatvam jnatva sprati balakshayam. Sarva indriyanam shunyatvam is specified indriya. This is actually identified in the same Charaka Samhita and Sutrasthana while talking about the Indriya Upagata Janya Vyadhis. That is Indriya Pradosha Vikara. There are two kinds we may see, Indriya Upatapa and Indriya Upaghata. One is the Nasha, another one is the Kinchit Vaikalyakara. When the Indriya involved. I will give you an example. Patient is bedridden. Patient lost control over bowel habits. Patient lost control over the urination. Catheterized. Sarvendriyanam shunyatvam. As we people are well aware, Panchaka of the Indriyas, Indriya Adhisthana to that of the Indriya Buddhi. When we are talking about the Indriya Buddhi, the Indriya Buddhi of the Payu and Upastha is lost. That's why the patient is having such a type of phenomena wherein incontinence as well as the control over the stools completely lost. Indriyanam, Sarva Indriyanam Shunyatvam. We may consider other things. Padau Gamane, Hastau Grahana Dharane. When we are talking about the Padau Gamane, Hastau Grahana Dharane, that is lost. That's why the patient is bedridden. Sarva Indriyanam Shunyatvam Jnatva Spratikshayam Balakshe. The higher mental functions are completely lost. Such a type of combination today we are getting in the OPs. Patient is initially started with the akinetic rigid syndrome. Slowly, the patient is slipping into the depression mode, and slowly the patient is not interested in any activities. Finally, the patient landed in Alzheimer's disease. Now you imagine such a patient and see the shloka, Sarvendriyanam Shunyatvam Jnatva Smriti Balakshayam. They are having only one option. Tatra karma urdhva jatrukam. Don't think about any other thing like that of the just sarvanga sveda, sarvanga snehana, etc., because the patient is already lost maximum bala. Tatra karma urdhva jatrukam. Right from the nasya karma, maybe even pratimarshanasya, or different kinds of the Murdni Tailas, whatever may be the type of Murdni Taila, fitting into that particular patient. may be selected and given. That is the idea of Tatra Karma Urdhva Jatratam. Another presentation, Pranavrte Samanesyu Jada Gadgada Mukata. Jada Gadgada Mukata. Three different things. One is the Jada. This Jada is referring to reduction in all motor activities. All motor activities. Now you can understand why I told about Va, Gati, Gandhana in the first slide. Jada, Jadyata. This Jadyata is nothing but a chair-bound status or bedridden status or any other thing, wherein the motor capabilities are almost lost. Radgada and Mukata. Complete aphasia or disarthria. This is another thing. He specified Sneha Tatra Sa Yapana Chatushprayoga Shasyante. He used the term Shasyante. Shastam. Shasta means Mangalam. It will do the goodness. He is not used any other term related with the treatment aspect or the complete cure. He used the term Shasyante. Each word is so important. Tatra Sa Yapana. Yapana Vasti may be considered here. Rajapana Vastis pertaining to Madhutailika group. Madhutailika Vastis are beneficially. Chatushprayoga. You may plan anything related to Tataila Vasamat. Ultimately, you are maintaining Yapana. You are Yapayanti. You are actually going to do the Yapana of the patient. Murcha Tandra Pralako Angasado Agni Voja Balakshaya Samanena Avrate Vyane Vyayamo Lagu Vojan. It is the final phase. Agni Kshaya, Vojakshaya, Balakshaya. Already we have seen one Kshaya leading to Marana. That is quoted in the context of Vojas environment. That's why, interestingly, you are seeing treatment. Vyayamo Lagu Vojana. Give the Lagu Vojana. Otherwise, the patient may end up with one digestive disaster. Vyayama, to prevent the hardest of the possibilities related with the patient is not in a position to move or flex anything related with the joints. That's why Vyayamo Lagu Bhojanam is identified. No prescription is given. This is, we are seeing in case of another phase of the movement disorders. Stabdata, Alpagnita, Asveda, Cheshtahani, Nimilanam. Even the movement of eyelashes is going to be difficulties. That's why Nimilanam. The word Unmilana, Nimilana, here we have to identify that movement is also Cheshtahani. Udane, Navrate, Vyane, Tatra, Patyam, Mitam, Lagu. We have to consider about minimum amount of medicine as well as something like that of Patyahara may be considered. Here, Patya, Tridosha, Shamaka things must be considered related with the food. Then, this is the progression, another progression, Kapha Vrata Vyana. Guruta Sarvagatranam Sarvasanja Vyane Kapavrate Lingam Gatisangaha Tata Adhikaha. Gatisangaha Tata Adhikaha. Many akinetic rigid syndrome patients are having this complication. Guruta Sarvagatranam. This heaviness they are starting. After giving the Rukshana Chikitsa for initial 1 or 2 or 3 days, that Guruta is going to be corrected. Patients are saying there is Laguta. Gati Sangaha Tatha Adhikaha. Progressive Sangha in the Gati. Movement, any movement. Maybe it's walking, maybe it is writing, maybe something like that of eating. Everything is going to be slowed down progressively. Gati Sangha Tatha Adhikaha. This is also another presentation of akinetic rigid syndromes. This is the deformity. Already we talked about the Snayu Gatatva. Majjavrate Vinamahasya Jrambanam Pariveshtanam. Vinamaha, forward stooping. This is one of the advanced phase of the Parkinsonian spectrum, wherein forward bending is the possibility, and Vinama is always indicative of involvement of the Snayu Vata, Snayu Gatatva of the Vata. Treatment towards Snayu Gatatva of Vata must be employed or incorporated here. This is Majjavrata Vata. Then usually we consider simply related with Udavarta Chikitsa, Udavarta involvement. Kunchanam Kubjata Ardita, remaining shloka are there. I am not touching that shloka part, Varchasavrata Vata. When the patient is having such a type of history of chronic constipatory bowel habits, or else when the patient is ending up with the symptom of the constipation, Kubjata. What is this Kubjata? Kubjata is nothing but forward bending. That's why the height is going to be having the reduction. Otherwise, yesterday he was 6, last year he was 6 feet, this year he is having 5.5. It is not the compression, it is related with forward bending. Kubjata, Ardita, Ardita, generally when we are talking Vata, anything. Kunchanam. When the patient is having the Snayu Gatatva of the Vata, when the patient is having such a type of phenomena, usually it ends up with the Kunchana, contractures. Already we considered a part related to Vata Guna. Here you see two terms. I am not interested in case of remaining things. Spuranam Vepanam Sharamaha. Spuranam Kinchit Kampanam, Vepanam Ekadeshe Vyaktam Kampanam. Two involuntary movements is talking. Kinchit Kampanam, Spurana. Whatever we are talking about fasciculations, tics, or tremors pertaining to a small area. Vepanam Ekadeshe Vyaktam Kampanam. This is also another presentation. It may be seen. And it is the common thing in case of the toxic Parkinsonism, particularly alcohol. With this background, I am not actually harping on any particular symptom. I am not harping on any particular nomenclature. I am just analyzing the involvement of the dosha, dushya, upadatu, ojas, anything like that of the specific visha, like that of the madhya. So treatment line must also be on the same lines. And we are talking about the treatment. If you are going through the Charaka Samhita, after deliberating everything, first line of management, Kevalam Nirupastambam Adosnehi Upacharet. He is not bothered about anything. He is bothered about the samsrishta avastha of the Vata dosha. He is bothered about the Ama dosha. He is bothered about the Sama dosha. He is bothered about the Kapha Vata, Pitta Vata conditions. That's why Kevalam Nirupastambam Adosnehi Upacharet. Nirupastambita Vata. If you are damn sure, prescribe the treatment of Sneha. I want to share my clinical experience. During my tenure of 3 years in Jamnagar, it is nothing but the Marudesha, to some extent semi-desert area, and maximum of Vata surplus presentations were there. Initially in the phase, direct Snehana, direct Yapana given, never objected the treatment, means the disease never objected. Presently, I am hailing in the Anupadesha. And when we are thinking about direct Snehana, it will give punches to the physician. indicative of it is not the Nirupastambhita Vata, it is the Upastambhita Vata. On the other lines, I have seen that those patients who are coming from the Deccan Plateau, near Gulbarga or Nasik, etc., when they are coming, pure Vata, Jangala Desha, involvement of the kapha is minimum in such patients. Whereas the local patients who are hailing from the Malnad area and the coastal area, exposed to the Kleshma Vradhakara Bhava, they are having the Upastambhita Vata. Hence, Rukshana line of Chikitsa is identified. Here in our hospital, we are doing one Agni Chikitsa Lepa or Alepa Chikitsa, which is the admixture of Ushna, Tishna, Vyavayi, Vikasi, Sukshma Dravyas, like Lashuna, etc., like Agnimanta, etc. 8 drugs are there. They are smeared on the body. It is nothing but Sarvanga, it is Upanaha, it is Niragnisveda, and it is given internally also when the Upastamba is more, Upastambhita Vata is more, and treatment, next line of phase of treatment is only pertaining to Shamana with the Sneha. That's why wherever it may be, whoever it may be, when they are considering Upastambhita Vata is there or not. Meanwhile, we are identifying some amount of Udvartana. Is also going to be having the very good efficient Rukshana line of management, and it helps. Then only Snehana must be considered. Within 1 or 2 days, if we are ignorant, if we are blind enough, and if we are starting the Snehana line of treatment, within 1 or 2 days, patients are having the specific symptom of stamba. That Ardra Vastra is put on the body, that particular feeling is identified in the patient. And that is important to identify. Patient should be subjected for the Sneha without Avarana. With the Avarana, Rukshana line of treatment, Deepana Pachana Chikitsa must be considered. All authors are having the similar kind of explanation. Even the celebrated Susruta identified this particular thing. That's why in Vata Vyadhi Chikitsa Adhyaya, he identified one important line of treatment, that is Vachana Deepana. We are having the example of Shardharana Yoga. Shardharana Yoga is not quoted in Gulma Chikitsa. It is not quoted elsewhere in GIT disorder. It is quoted in the context of Vata Vyadhi. That's for the sake of conversion of Samavastha to Niramavastha. After that only, one may think about Vishodhana, Shodhana Chikitsa. That's why we are having different options. Anulomana or different kinds of the Shodhana. Mradubhi Sneha Sayuktai Aushadai Tam Vishodhaye Sroto Budva Anilam Rundyat Tasmattam Anulomaye, he specified. So, such a type of anulomana is required. Maybe anulomana, sramsana, etc. One novel prescription, Aragvadadi Kashaya or Aragvadarishta, is used for the prolonged period. This is having the glimpse in Charaka Chikitsa first chapter. While dealing with the Shodhana, prior to the Rasayana, Shodhana must be given. And one such prescription is Harita Kyadi Yoga. After that one, he specified, you have to consider the Yava Pradhana Ahara for a period of 3 or 5 or 7 or 10 days. Triratram Yavakam Dadyat, like this we started. It is the indication. Or till how many days? Yavat varchestu shuddha. Purisha should be having the Shuddha Lakshana. Till then also you have to give. The same thing may be considered here. Shodhana in a different perspectives. Maybe Anulomana Samsana Vedana like this we may consider. May be related with the actual Virechana we may consider. If it is not possible, Durbalo yo avirechya syattam niruhai upachare. Already we discussed few things, aged fellow 80 plus, patients with multiple problems like that of the hypertension, DM, etc. In such conditions, niruha basti, durpalo yo avirecha, when the virechana is not possible, plan something like that of the niruha basti. It is the general principle. We may consider something like that of the yapana basti. We consider Rajayapana Bastis, Mustadi Rajayapana Basti. We consider Vipanchamuladi Niruva Basti. We consider Guduchyadi Niruva Basti. This Guduchyadi Niruva Basti is also experimented on rats and mice. Then also gave very good regenerative follow. I have already quoted certain Anyonya Varana. Navanai Dhumapane Sarvane Upapade. Navananasi may be considered in such situation because the patient is not Benga or the patient is not fit for the Pindasveda, etc. Patient is not even fit for the Niru Bastis or Matra Bastis, and patient is requiring some amount of the Shodhana. Navananasya may also be considered. Then what is the media? Media is to be considered. Nasti tailat param kinchid aushadam marutapaham. You consider the taila. Base or the modus operandi is taila. As far as possible, whatever the things are related with the taila, we may identify. Bala taila is one such prescription. Shuddha bala taila is one such prescription. Kshira bala taila is one such prescription. May be used in different formats of Navana, Avapedana, Dvapana, like so. Navana, Avapedana, like so. Prescriptions like that of the Nakula Taila. I have tried Nakula Taila. In the form of Nasya Karma, significantly reduces the symptoms of tremors very quickly. That may also be identified. With Ashwagandha Taila or Ashwagandha Grata may also be considered. I have tried Ashwagandha Kshara. Looks awkward, but it is one of the prescription in case of the Shwasa. In pediatric practice, Ashwagandha Kshara. And that Ashwagandha Kshara I prescribed in the patient, wherein something like that of the Avarana is also present, patient is also having the Mamsakshaya. So, tried that Kshara. Such things are also going to be beneficial. Or the prescription Tailam Agurvadya Mudartam Mitya Shita Jware. This is one of the concepts quoted in the Jwarachikitsa Adhyaya of the Charaka Samhita. Agurvadi Taila, which is having 90% Ushna, Tishna, Vyavai, Vikasi drugs. And that may be considered Agurvadi Taila. But if you are not able to do the Agurvadi Taila in one patient, I have accumulated all the ingredients of the Agurvadi Taila except the Taila. Remaining things are made into fine powder and mixed with the Takra and Dhanyamla and applied on the patient. It also showed good results. Agurvadi Taila. Instead of Agurvadi Taila, this is Rukshana Chikitsa achieved in this form. Provided the patient should be having the Samavastha, Avarana, Sumsrishta Vatavastha, then only. Vyatyasat Karayet Kriyam. This is one of the important prescriptions we have to identify in the treatment of almost all the neurodegenerative conditions. I am using the term degenerative with the perspective towards the Kshaya. So we require the treatment of Rasayana. We require the treatment of the Brahman because it is Kshaya, degenerative. At the same time, if the patient is also running with some amount of Samavastha, what to do? That's why this line of treatment is considered. You see the arrangement of Charaka Samhita's last chapters. Urustamba, Trimarmiya Chikitsa, Urustamba, Vata Vyadhi, Vata Shonita, and Yoniva. All are requiring maximum Vatahara line of treatments. Involvement is with the Vata dosha. That's why line of treatment Vyatyasat Karayet Kriyam. If there is some Srashtavata, if there is some amount of Avarna, if there is Samavata Avastha, prescription related with this one, both the situations, that is for Kshaya, what is for the Avarna must be. If we are able to keenly observe patient, then that Sangha may be identified in one or other phase of the life, Sangha. And patient is also having the previous things influenced and Kshaya is also there. At that juncture, Vyatyas, Parivyatyasaat iti Parivartanena. Sheetam Kratva, Ushtam Kratva, Sheetam. It is not with the Parishek or any other thing. Line of management, Sheetam Kratva, Ushtam Kratva, Sheetam. Apataram. Because Sheeta, Ushna belong into two distinct opposite spectrum. So such a line of treatment means identify the Sneha, Abhyanga, etc. line of treatment on the one side and another side like Purishek, etc. things simultaneously or in one or other form or things like that of Swedas. Even Guru Pravarana is also one of the things we may consider. Likewise, the treatment should be if you are going for the explanation, it is endless. Only interesting things I will take up. This is one of the important things. Already we considered Masha, concept related with the constipatory bowel habit, relationship with the Udavarta Samprak, and phenomenon Kampayati iti Kapi Kachu and Kapi Kachu's Pratinidhi Dravya. Kapi Kachu, Kampayati iti Kapihi. The monkey, it is doing bizarre activities, whatever it may be. Such things are seen in case of any movement disorders. What is the importance? Is it only that one? No. Please go to the zoological aspect of these kapi, monkeys. Monkeys are living in herds. They are not living solely. So when they are in herds, one senior monkey will be there. That senior monkey is actually having or it is ruling the whole herd. And it is competing with others and it is going to quell on the other male monkeys and it is mating with the female monkeys. It is the zoology. And these monkeys are interestingly having the monopoly over Kapi Kachu Bija. They are not allowing any other monkey, that old or senior, whoever it may be, that monkey is actually having the monopoly over Kapi Kachu and it is having. And it is balishta. It is having good bala. Probably, I don't know, Lokapurusha Samyavada, etc., etc. They identified this phenomena and identified this one in the treatment. Current practice of neurology, when we are seeing, is the rich source of dopamine. Now, when we are talking about the dopamines, levodopa as well as carbidopa, The biggest problem with the levodopa, carbidopa, or any other drug is related to the blood-brain barrier. Whatever may be the amount you are pounding in the patient, less than 10% is going to attain the cerebrum. Means for that circulation, only 10%. Suppose if we are giving some 10 grams, 1 gram is only going to attain the cerebrum. On the other hand, Kapikachu is having more than that of the synthetic carbidopa levodopa concentration. Hence, it is one of the trend that some companies are prescribing exclusive Vanadi. This is one of the phenomena. In the same way, there are certain things like that of the Mashabaladi Kashaya. Mashabaladi Kashaya, this prescription is both helpful in case of neurological as well as a degenerative condition. This may be given in the patient. I have given glimpses about Nakula Taila and Abrakabasma. Abrakabasma, not the simple 10 or 20 putti is useful. Sataputti and Sahasraputti are useful. It may be mixed with any other bulk promoting agents and it. Rajayapana Basti in repeated intervals are those patients who are having 60 plus and symptoms of the Parkinsonism. At that juncture, Rajayapana Basti or Madhutailika Basti given in intervals of some 3 or 4 months throughout, it is going to be beneficial. To subjugate the Vata dosha, Dhara or the Abhyanga is beneficial thing. Abhyanga may be with any other oil. Not only related with the Mahanarayana or Madhyama Narayana or Swalpa Narayana or the Kshira Bala, Shuddha Bala, etc. I have told about one particular symptom, Shushara Karani, Randra Karani, and we have to prescribe Ghana. One may prescribe Karpasa Astyadi Taila. Karpasa Astyadi Taila, Nasya may be given, Karpasa Astyadi Taila, internally may be given, Karpasa Astyadi Taila. Matra Basti may be prescribed, it may be prescribed in the form of any other route. Vana, Abhyanga, Nasya, Bastishu Yujyate. This may be considered and it is useful. That is in conditions of Sushira Karani. So, prescription of the Karpasa Astyadi Taila or in Abhyanga, any Vata Harathi may be identified. It is line of treatment. Treatment pertaining to Bastaya, Sarpisha, Panam, Prayoga, Kshira, Sarpisho, Abhyanga, Udvartana, Snana, Anna, Panam, Chavatana. This is actually taken up from the point of Madatya Chikitsa. Madatya Chikitsa prescription is taken and it is the same thing whatever we are doing in case of Vata Vyadhi. The organizers are having certain idea behind the organizing of Vata Vyadhi Vicharam. When they contacted, what is the idea? They told that they want to bridge the gap between the current practice of neurology and Ayurveda. When they want to bridge the gap between the Ayurveda and the neurology, the things which are identified some 2,500 to 5,000 years back, they want to identify it in the current spirit of neurology. This is one example. I have told them already, and for you people also I am telling the same thing. Identification of each and every symptom requires maximum effort from the lexicons, that is right from the Nirukti, Vyutpatti, etc. How the term is derived, accordingly we may consider line of management or line of treatment. So, a word Vepana, a word Kampana, a word Kampat Vata, a word Tandava Vata, these are not merely sufficient. In depth, or we have to go into the details of each and every condition. Hence, finally, humbly I say, I don't want to equate Parkinsonism with any of the said neurological deficits. I want to say certain things pertaining to different dosha involvement, different dhatu involvement of the trimala, involvement of the ojas, involvement of the upadhatu, accordingly line of treatment, accordingly prescription going to vary. Probably Sushruta might have considered this situation very quickly in his lexicon, said Ekam Shastram Madhyano na Vidya Shastra Nichayam Tasmat Bahushruta Shastram Vijani At Chikitsakaha. Who? Chikitsakaha. The physician should learn many. During his time also, he might have identified this one need. That's why Ekam Shastram, Ayurveda Shastra only don't rely. You have to read different other things. Those things are identified in case of Lokapurusha Samyavada. Those may be seen in Veda. Those may be seen in case of Shiksha. Those may be seen in Nirukta. And finally, one conclusion is identified. That's what a total approach towards to the given situation. Tasmat Bhushruta Shastram. That's why organizers might have considered this shloka Ekam Shastram Madhyano na Vidya Shastra Nischayam. Hence, neurology Shastram api Bhushruta Vijaniya Chikitsakaha may be the possibility. Thank you, Ananda.
Profound description of the topic, sir. You have brought in so much light to the whole domain of neurology and Ayurveda. Thank you, sir. Thank you so much. The session is now open for discussion. Dear delegates, you may get your doubts cleared straight from the master. Sir, there is one doubt. What is the exact difference in treatment approach to Samsrishta and Avarga dosha in Vata?
Very clear. When there is Samsrashta Avastha, not mere something like that of the Snehana Chikitsa should be started. Instead of that one, Rukshana Chikitsa. What is Rukshana Chikitsa? Suppose the patient is having the good musculature, plan about the Udvartana. Meanwhile, on the same day, one may plan something like that of the Abhyanga. Or patient may be subjected for the Sneha Yukta Sweda, like that of the Bhashva Sweda. Patient may also be subjected for Pinda Swedas. Meanwhile, the internal administration of Gandharva Stadi Kashaya, Shardharana Yoga, Panchakola Panta, Dashamula Kashaya must be thought of. And when this is combined together, total treatment will be complete.
Sir, thank you, sir. Can you share your experience of the application of Sahasrari Rashayan that's mentioned earlier?
Sahacharati iti sahacharaha. The definition itself clear. Sahacharati iti. Along with the person. Person means who? Person is patient. Along with the patient, the sahachara is also giving. In other words to say, Sahachara is going to give strength to the patient related with the walking. Now, where to use this one? Sahachara is useful in musculoskeletal conditions. Sahachara is useful in case of the neurological deficits in both the situations. This is based on Loka Purusha Samyavada. You please go through the creeper nature of the Sahachara and its allocation on the dendrites and neurites, and you plan it. In other words to say, a patient who is having difficulty in walking owing to the hypokinesia gives Sahachara. When the patient is having the pain in different joints owing to the stiffness or rigidity, give the Sahacharadi Kashaya. When the patient is requiring the Vata Shamana predominantly, give the Sahacharadi Savyam or give the Sahacharadi Tailam for external application, provided there should not be Amaduksha. Likewise, we have to select the Sahacharadi Taila, Sahacharadi Kashaya.
Namaste, sir. Sir, when it comes to the neurodegenerative spectrum of disorders like Parkinson's, idiopathic Parkinson's disease, when it approaches us, how will we decide that how long the Basti has to be done? What exactly could be the Samyak Basti Lakshanas that we witness in the patient during the course of treatment? Is there relevance of that, or we
As far as my perception, your question is related to the relevance of Basti
Yes,
and
sir.
where to use Basti. Am I right?
How long we use it?
See, there are many aspects about this one. We are not supposed to give the Bastis for the prolonged period because again there will be Vata Prakopa. I am talking about Nirva Basti. So in our scenario, whatever I have prescribed is the Kala Basti regimen. And very rarely in other patients, I have prescribed Karma Basti. So Karma or the Kala is given. While dealing with this one in Siddhisthana, Charaka identified this Karma, Kala and Yoga Basti regimen is for Manda Buddhi. I am a Manda Buddhi person. So what I thought is, instead of searching for the Durnirudatva, instead of searching for the Vata Prakopa, it is better to identify Karma, Kala, Yoga depending upon the patient's pocket, availability of the medicine, as well as the Samanirama Avastha, and selected Yoga and Kala Avastha. This is one. Second thing, in few patients, I have prescribed one aspect. Matra Basti is for the prolonged period. What is the prolonged period? I did one mischievous thing. What is that mischievous thing? Ashta Dashashta Dashakan concept. Quoted that 18 into 18. 18 into 18, 328 in such a way that it is actually for 18 Karma Basti concepts, not related with the 18 into 18, 328. But I have tried. This was tried, of course, first in a patient who is having avascular necrosis of the femur, and Matra Basti was prescribed. And it's over 2000. There is a 2000 after 2000 means 25 years are over. Still, I am seeing that boy working, and that boy is not, of course, no, it is middle-aged person. He is middle-aged person, and he is not having any complications. And he was on crutches previously. Now he is not having any problem. He is a sentry in ATM. This much changes I observed. And I thought it is better to give this compromised variety of Matra Basti for such longer durations. The same thing is employed in case of cerebral palsy, small children. That also showed very good result. So my perception is you select karma. If not possible, go for kala. If not possible, you go for yoga. After that, you plan for matra basti because anuvasana basti is having certain restrictions. You have restrictions about the timing. You have restriction about the prevailing condition. Whereas Matra Basti, Nirapada Basti, it is having no such restriction. Go for prolonged period of 328 days also. So like this I have tried. This is one. Second thing, after 3 or 4 months, when the patient is coming back, I have again prescribed these Nirobastis. Again for Kala or Yoga, usually Kala Basti. And it suffices. So 3-4 seasons, so means 3-4 years. In such conditions also, when we are giving so, patients are having good result related with their mobility and progression was stopped. Patient is having improvement in certain minor things. I am not worried about Samyak Niroda, etc., because as far as the disease activity is reduced, as far as symptoms are reduced, remaining things are not important for me. With all Samyak Niroda Lakshanas, if the patient is not in a position to identify anything like that of the reduction in the symptomatology, otherwise it is futile, hence I don't want. So this regimen is considered. I think you got the answer.
In that context, in adding to that perspective of going for repeated treatment. So when it comes to a neurodegenerative disease, for example, Parkinson's disease, how will we decide what should be the frequency of treatment? In your clinical experience, is that the response of the patient or the chronicity of the Samprati, or what are all the factors that you take into consideration? Well, frequency of undergoing Kriya Damas after an
Your question is related with the two things, as far as my perception is considered. One is related with the how many times we have to do, that is frequency of the treatment. Second aspect you have identified is related with the benefits. See, frequency in the sense, it is paid hospital, wherever I am working. It is not the charitable thing. So each and everything we have to consider, patient's pocket, patient's stay, the medicine charge, etc. Usually for 8 days, when we are admitting the patient, we are planning for something like that of the yoga basti. One, repeated yoga basti is considered 3 or 4 times a year. After that, patient may be identifying relieving and they may come for once or twice a year. Meanwhile, Shamanaushadha must be continue. One more aspect, if the patient's party is able to do the Matra Basti, we are training them and asking them to continue the Matra Basti. Meanwhile, when we are practicing Matra Basti also, we have to identify Sama Kapha Lakshanas quoted in the Sama Vata Lakshanas quoted in the Charaka Vimana, 2nd chapter, Trivida Kukshiya Vimana. If the patient shows the slightest of such things, the treatment related with the sneha must be stopped.
Sir, in that context, could you again put some light on a few treatment experiences where the patient has not started Sindhopa? Usually, they have not started Sindhopa, Parkinson's case. Usually, patient approaches with already Sindhopa. So if such cases come, we have identified it as IPD, but they are not on modern medicine. How should be our approach? And how will be your opinion on the course of treatment, sir? And young
Here,
patients,
two
probably
things are
45 to 50, the usual range now.
Two things are important here. First one is related with the continuation of the same dose or similar dose. If the patient is able to halt the doses in the same pattern, that is also one of the in case of PARCs. If the patient is taking something like that of the controlled release tablet of Syndopa in the night, remaining Syndopa plus in the morning hours, once in 3 hours or once in 4 hours, etc. If it is maintained on the same, that is also one of the treatment benefit. Second thing, if the patient is withdrawn from the controlled release tablet, as well as frequency is increased, that is also important. When the patient is coming to we people in the advanced phase, preventing them from chair-bound or bedridden status, that is also improvement. And in the initial phase, when the patient is coming to we people with semi-baked, in the sense halfway they stop the Syndopa or Amantril or Pacitan, and then they are coming without any hitch, we may stop the, or we should not restart the Syndopa and we may consider. How to withdraw that one? The novel idea of Padamsham, 1/4 acclimatization of our medication, 1/4 reduction of the Syndopa, Pacitan or the Amantril may be considered. It all depends upon the level of degeneration we have to consider. The degeneration is too much. At that juncture, many times it is not possible to stop at all. Instead, it is possible to reduce one dose, remaining dose may be continued. There are many patients I have seen. There is one patient who is from a downtrodden poor family. Since 23 years, she is under my observation, having difficulty about the food also, forget about the medication. And if we are giving the medication for 1 week or 2 weeks, he will come after 1 month or 1.5 months. In such condition also, with a lot of familial stress, in such conditions also, I never started with Syndopa or Amantril or Pacitan. And she is able to do her routine work. Now she is aged about 70 plus. She is coming to the clinic alone. She is not requiring anything like that of the support from others. She is able to rear 2 or 3 cattle and she is one of the in charge of old age home. She is coming to the clinic with bus or auto rickshaw on her own. That means nothing but it is the person's willpower as well as the medication. Manas is also important. That's why I raised the concept of the bala. And while dealing with the concept of the bala, manobala is also important. Yes.
Sir, regarding a progressive case of multiple sclerosis or an evolving GBS, how can we interfere in such cases by arresting the Vata?
Yes, please repeat the question.
Sir, in a case of evolving GBS,
Huh.
Guillain-Barré syndrome or multiple sclerosis, where the patient is progressing fast, the condition is progressing fast, how can we interfere by using our medicines, especially stamina auxiliaries, in preventing the further Nadupaka?
See, your question is not clear to me whether it is Guillain-Barré syndrome.
No, sir. Yeah, it's a progressive GB syndrome or multiple sclerosis.
No, both
So
are
how
different.
to,
Sclerosis is different, GB syndrome is different. It is not one and the same. What is the question exactly?
In those cases, how to intervene in the acute phases to prevent Nadupaka?
See, about the Dhatupaka, concept is clear. Degeneration alone is not going to do the Dhatupaka. Anything other should be having the predisposing or any other factor is inducing such a type of phenomena. Then only Dhatupaka is happening. Dhatupaka is not the sole thing which may be seen in cases pertaining to all progressive degenerative disorders. Coming to the GB syndrome, when we are talking about multiple sclerosis or GB syndrome, it is Samprapti is entirely different. You plan for one more online GB syndrome seminar, I will tell you about how GB syndrome should be approached. Because concept related with the Medasavrata Vata as well as concepts pertaining to the Vata Kshaya and involvement with the Dhatus, Rasa to that of the Mamsa is different in case of the GB as well as in case of the MS. When you are talking about the MS, even the concepts of the Abhishanda also coming to the picture. In case of the GB, Samprapti may vary from Jwara, Jwarottara Dorbalya and Dhatugatattva of the Jwara and landing into a status of the Urusthamba. So it is not one phase. Paroxys or akinetic rigid syndromes or movement disorders are entirely different. And this group is entirely different. So many a times in GB, Jwara Chikitsa is employed and Jwara Chikitsa is going to be beneficial. Whereas in case of MS, the treatment of Jwara may not be helpful. One more concept of Punaravartaka Jwara, that is to be identified or something like that of the Dhatuka Jwara or Vishama Jwara concept is important there. These two are having different planks, not the same plank. Both are having different altitudes. So both are not one and the same.
Thank you, sir. Sir, one or two more questions. It will be okay, sir.
Yes.
Yeah. Sir, when you come to other spectrum of neurodegenerative like Alzheimer's, dementia spectrum, dementia spectrum of clinical condition. So, of course, when patient approaches maybe they are in an advanced stage.
You are talking about dementia, Alzheimer's. You are talking about dementia.
Yes, sir, dementia, Alzheimer's.
Alzheimer's. See, dementia is a very big platform in which Alzheimer's is one such thing. So, when we are talking about the Alzheimer's or dementias, depending upon the phase of the disease, it varies. For example, in Unmada chapter, he talked about Sheela Vibrama, Shaucha Vibrama, Achara Vibrama, like so. They are all coming under this, these Alzheimer's, different phases are coming under this one. There is a concept of Atatvabhinivesha. Atatvabhinivesha must also be incorporated while dealing with this one. When we are seeing certain progression, Anyonya Avarana, already we have talked about Anyonya Avarana, Sarvendriyanam Shunyatvam Jnatva Smriti Balakshayam, then that is also important. So, it is not under one heading. Right from the Unmada, right from something like that of the Apasmara as well as Atatva Abhinimesha, Anyonya Avarana in such conditions must be incorporated and different presentation has to be viewed, and that is related with dementias. It is not coming under one category. And line of management is also different according to the situation. A person with prolonged diabetes mellitus, slowly developing into memory impairments, and in due course of time he is ended up with vascular dementia. His line of management should be on the Sutrasthana, Charaka Samhita, involvement of the Ojas, and the Prameha or Madhumeha mentioned there, and that Madhumeha plus Atatva Abhinivesha must be incorporated, not one. So, conventional line of identification of Achara Viprama, Sheela Viprama, Shaucha Viprama, etc. must not be considered here. Instead, we have to start the treatment from the point of Prameha onwards, because it is Anyonya Avarana. Sutrasthana reference Samprapti of Madhumeha Charaka Samhita.
Thank you, sir. Sir, we have a last question. So, sir, among the Panchakarmas, if we come to think of the Parkinson's spectrum disorders, whether idiopathic Parkinson's disease commonly, so which will be the best Kriya Dharma? So when we think Prana and Udana are involved when the patient comes to us, Nasya and Basti, we say, are the best Panchakarma in Parkinson's spectrum. What's your opinion on that, sir?
In a single word, if you want to get the answer, Basti.
No, we are not accepting single words, sir. The possibilities, Basti and Nasya.
Ideal thing is Basti. Nasya only Jatrurdagata symptoms. Prescription varies according to the patient's presentation in my practice. It is not one and the same like that of the Sindopa, Acetone or something like that. My prescription varies according to the patient's presentation. At times, I may ask the patient to consume only idli and dosa. Many a times.
Could you put some light on that differentiation, sir, before we end?
Huh?
Yes,
yes, tell me.
Yes, sir. Could you put some light on how you prescribe according to the patient's presentation?
One example I will tell you. Patient is coming to we people. Simple history of alcoholism and aging some 50 plus. It is Srikandasava such prescription. Pushmandasava you may consider. You may consider Ekanga Virasa. If the symptoms are unilateral on one side, Ekanga Virasa may be considered. If the patient is having the head tremors, body tremors, and patient is having the difficulty, we may consider Sahacharadi Sevyam, we may consider Balataila Sevyam, we may consider Indukanta Kritam, so on, provided there should not be anything like that of the Samadosha. If the patient is having the bizarre activity, if the patient is having the dearth of male characters, we may consider the Vanari Kalpa or the Kapikachu related prescriptions. If the patient is possessed with some psychiatric symptoms, like that of the Tushni Bhava, and patient is having something like that of a depressive mood. In such conditions, we may think about the Panchagavya Grantha. We may consider Kalyanaka or Mahakalyanaka, Panchagavya or Mahapanchagavya or Ashwagandha Grantha. We may consider the prescription of the Ksheerabala capsule or Gandhathaila capsule, provided the patient is having the phenomena pertaining to motor symptoms. If the patient is having the sensory symptoms more, may be related with the speech, may be related with any other thing pertaining to the perception, at that juncture, Ganadanayanadi Kashaya is one such favorite prescription we may consider. We may consider Abhraka Basma, we may consider the Vaikranta Basma in such situation. Another prescription you may consider Bhratvata Chintamani with gold. You may consider plain Makaradhoja also in such patients. Young patients who are possessed with the phenomena of akinetic syndromes, having lot of stress, in such conditions, Makaradhoja prescription is one of the ideal things for all such ailments. Navaratna Raja Margankarasa is one of the prescription when the patient is having the stressful IT business, and prescription may be considered for a prolonged period of some 90 days also, and it will help the patient. Like this, depending upon different conditions, owing to the dosha and dosha, we are having different prescriptions, not something like that of one prescription for every samprapti.
So shall we take one more question if time permits?
Yes, tell me.
Yes, sir. So, one of I think it's from the students. How modern knowledge and clinical examination.
How modern
knowledge and clinical examination in help with Ayurvedic disease diagnosis. So I think this is always a dilemma. Like when we have time, should we spend our time more in Ayurvedic classics in the present context, or in modern neurological examination or clinical examination as a senior academic clinician? What is your upadeshan to all of us over here?
See, I am not a great person to give any upadesha. I am a person with practical inputs only. I will tell few things or few tips. Knowledge of modern neurology is required, not for the sake of prescribing Ayurvedic medicines or therapies. I will forget all the modern knowledge acclaimed and forget about those things and start the Ayurveda prescriptions on the basis of Ayurveda. We may corroborate the things with the modern neurology, but it doesn't mean that all modern neurology knowledge may be compared with the present status of Ayurveda. Not possible. What I mean to say is, identify the things with the clinical examination, higher mental functions, olfactory related with the cranial nerves, bulk tone, power of the muscles, reflexes, deep tendon reflexes, involvement of the extrapyramidal, pyramidal tracts, everything. But whether it is going to change the prescription, mostly no. Our idea related with the avarana, our idea related with the samsrashtavata, our idea related with the shuddhavata, our idea related with the association with the other disease, all such things are coming to the picture and we are totally treating the condition, not one thing only. That is the idea. Hence, modern neurology, we have to learn and we have to explain it to the patient, because that is most easily explainable to the patient or patient party, not the avarana. Patient party cannot understand avarana. He cannot understand the samsrashta. He cannot understand Shuddha Vata or Shuddha Kapha. He understand, of course, bulk of the muscle reduced. You tell them, they will identify are able to identify, they will search in Google Mata and they will identify. That's why modern knowledge is required. That is required. But when you are prescribing the Ayurveda, modern knowledge is of no use. You have to think on the lines of the Samsrashta, Avarana, Sama, Nirama, Shuddha status, etc. only. Not related with the, this is related pyramidal, extra pyramidal, or something like that of cerebellum is involved, etc. That is only for the sake of few superficial things only. In depth, when you are treating, it's of no use.
Thank you. Thank you, sir. Thank you so much for that insight. So we will end up the session with one more last query that has been from the audience. In Kerala, we have actually practice of Rao-Ayurvedic limited, especially the neurodegenerative, and we all are aware that you are known for Rao-Ayurvedic practice too. So we will end the session with few of your experience and opinion on usage of Rao-Ayurvedic pertaining to today's topic of discussion, Parkinson's, if possible.
See, there is one Kampavatari rasa. There is one Khanjanikari rasa. These are one of the best prescription one may consider. Khanjanikari rasa. Textual only. Kampavatari rasa is also available. It may be practiced. And if you want more information, one of your resource person, I am seeing his photo, Mukesh Edavalat. Mukesh Atta, where are you? And in this institution, I did one Rao-Ayurvedic based prescription workshop way back, some 12 years back. Slides are with him. You ask him, Mukesha, and he will give you that one. And if required, we will go for deliberations. And our college is having one more new thing nowadays. They are entertaining internees for a short period of 15, 20 or 30 days, some with some fees. And they may come for the training here. And you may plan for such the trainings also. And about Rao-Ayurvedic, it is 2.5 hour deliberation from my side. You ask Mukesh. With the slides, it is with him. Okay? Thank you. Mukesh, can you hear me? Mukesh, can you hear me?
Yes, sir, I can hear you. Actually, I was hearing the class, the whole class, but there was some range problem, so I was in and out.
See, one seminar was done at Kottakkal way back. You remember?
Yes, sir. Yeah. The house agents, they have conducted one seminar and you have come. I remember.
Some question about Rao-Ayurvedic. I deliberated many Rao-Ayurvedics there. You give certain explanation about those Rao-Ayurvedic session. Okay?
Yeah, sure, sir. Yeah, sure. Sure, sir. And also, thanks, sir. Thanks for the wonderful session. It has been, a refreshing experience to hear you after so many years. It's always a music to my ears to hear my teacher's class. So, thank you, sir.
Okay, see you.
Thank you, respected Niranjan Rao sir, Mr. Dr. Anya, who have been contacted you. And we have heard from Mukesh sir a lot about you. And I was also fortunate enough to be a part of the neurology workshop that you were mentioning 10 years back at Kottakkal. So I think I do have the slides with me that you had presented at that time. So I'll definitely make time and try to share it, sir. So on behalf of all of us over here, delegates of Vata Vyadhi Vicharam and the Department of Chikitsa, Panchakarma, from Ashtamgam Vidyapeedham, the whole Ashtamgam family, we are indebted to you that you have been a part of Vata Vyadhi Vicharam. Even though we couldn't have you here physically, but we could really experience the vastness of the knowledge that you have shared with us in the same spirit. We wholeheartedly wish that we will continue our journey with your knowledge and inputs. Thank you very much, sir, to be a part of our thank you so much, sir.
Thank you.
So there is, as a token of love and respect, even though we are online, we have a certificate for you displayed, sir. So you can access that online. Thank you, sir. Thank you, sir. Once again, from all of us over here, thank you again for your valuable time with us, sir. Thank you so much. Thank you.